So my technique for preventing dog ears at the time of surgery is to do liposuction before the procedure starts, at the very beginning of the procedure, so we can thin down the area just in front of the armpit, because a lot of guys will carry some fat just in front of the armpit. And then also liposuctioning off to the side, where what I call the side boob, to make that as tight and flat as possible before we start to do the skin contouring. And then we also try to prevent dog ears by following the incision as far around as we need to, so that the scar lies perfectly flat. And that decreases the likelihood that you're going to need a long-term revision. So I just keep going until things look as good as I can possibly make them, and that's my motto. And when I do surgeries, I make sure that I pretend that it's me on the operating room table, and I would do for me what I would do for my patients.
So like he was saying, nobody wants to be treated like a project. They want to be treated like a person. In other words,
Right.
It's not just procedure that's going on here.
It's not a factory, and we individualize it, and we take as much time as we need with each patient to make sure that they're getting an optimal outcome. And then as far as post-operatively, patients need to not stretch out their incisions, and so they're limiting their activities, no running, jogging, heavy lifting for 4 weeks, and they can start to reach above their head after 2 weeks, but no vigorous stretching. So it's anything that's comfortable, you stop where it feels comfortable. And then chest exercises can recommence at 8 weeks. So bench press, chest flies, push-ups, and that would decrease the risk of having to do a revision for a widened scar.
Can you reduce the widening of the scar?
Scars can be revised, and typically we wait at least a year after the initial surgery, because you want the tissues to relax as much as possible. And then you can go back and take out the widened part and reclose the skin together, so that hopefully the secondary scar that's formed will be a thinner scar than what was there originally.
Can you say something about smoking and drinking?
Well, obviously, yeah, we like patients to refrain from any types of nicotine products for a month prior to surgery, because it's the nicotine in the cigarettes and the patches and the gum that constrict blood vessels and blood supply. And obviously we need blood supply to heal wounds. So if you don't have good oxygenation to your tissues, you're not going to heal properly. And it can be a risk to the nipple grafts as well. We don't want the nipples to fall off.
Dr. Sassani was also the director of the wound care center at the hospital next to us for how many years?
Like 10 years.
Yeah, so he has all the experience from doing that as well. And then when can they start smoking again afterwards?
Well, hopefully after they've stopped smoking, they won't restart.
Okay, but if they do,
a snack, okay.
it should be how long?
Probably about a month.
A month
Because by
later.
that point, the nipples are pretty well healed.
And what about drinking?
Alcohol if they're not taking pain medication, you can start resuming alcohol. So it's the opiate pain medications. You don't want an interaction between the alcohol and the opiates.
So they should drink how long before?
Usually about a few days before.
No
A
drinking.
week, no drinking, and then a
And
week
then
afterwards.
Okay. So
I lost my train of thought. What I was going to say.